Thank you for doing this.
Oh, of course.
It's interesting because Charlotte gives different information to each person.
Mm-hmm.
Like, I wonder if I should have given you a little more information on her, or you don't, like, what's your opinion of that?
It depends on what the goal of the interview is. If it's a interview to assess the entire diagnostic picture and then make a treatment plan, I think that it's more important to have some details going in so that you can kind of check all the boxes on the list. But I really approach this more in terms of trying to get to know her as she knows herself and help her advance her own understanding of herself and her problems. Mm-hmm. And I think she was able to do that. And it's almost like you have to let the conversation unfold because every person is different in the face of another person who is bringing themselves to the table. So whatever she brings to the table with another therapist like Karen Jacob will be different than what she says to me.
Right.
And I think there is a very human interactive component to it. So I think she was very much invested in not having the same conversation that she had with Karen, but I think it also will take her further to just take on a different angle of her difficulties in her conversation with me. I found it very productive.
Yeah, no, I did. Yeah, and you came up with something new for her that she hadn't thought of before, which was very cool.
Yeah. I think that sometimes people with borderline personality disorder are almost shaped to see themselves in such fragments, partly because of the intensity of how they experience themselves and how it kind of polarizes different parts of themselves, like the very people-pleasing side of her that arose from the need to walk on eggshells with her mom versus this angry side of her that is both identified with her mom but also a reaction to the abusive behavior. And then the psychiatric profession perpetuates that by giving all sorts of unrelated diagnoses when I think the core engine is this problem of emotional and interpersonal hypersensitivity from having had very intense adverse relational experiences. And then they get into these behavioral interchanges where one person is the persecutor and one person is the persecuted. One person is abusive, the other one is abused, because just the intensity of the interaction, the emotions involved, the feelings that each person has about each other based on their interaction. And so I do think it's inevitable on some level that if someone like Charlotte has had a lot of childhood adversity with a parent, it sounds like the other parent was absent, passed away.
He's not alive anymore, but she was close to her dad.
But she was left with this mom that was very dysregulated. And of course, that leads to the child never developing the capacity to regulate predictably or reliably. And so they do, in fact, oftentimes because of both a contribution of genetics and shaping through life experience, they are inevitably going to become just like that person in their life, their caretaker that didn't take adequate care of them. And that creates both some emotional intensity, but also it really further complicates that already troubled sense of self the person with BPD has. You know, I'm bad. I'm like this other bad person in my life. You know, I was hurt by the behaviors that I now, enact on other people. You can see she feels sorry for other people for anything she does, whether she stretches her legs or says something that she feels like would be unacceptable. She apologizes a lot. And that's what kind of breaks my heart about it, is in her just trying to interact with me, which was pretty smooth going. She felt such a need to placate and fashion herself in a way that just seemed like not what she wanted to say.
Right. So what's her way out?
I think there were many glimpses within this interview where she would just allow herself to be more intelligent and opinionated and assert herself. And I think there was one instance in which she said, "I'm sorry for interrupting," but she then went on talking anyways. And I thought that was a real strength of hers, is while she's a little self-effacing, she still has a lot to say. Yeah. And she was fairly articulate about it. And I find that when you show positive regard for someone who has these sensitivities, they will give you their best shot at interacting with you. And it's when you start to kind of show some cloudiness about what you think and feel about them that then they start to kind of get disrupted, dysregulated, and more incomprehensible. So you can use that interpersonal hypersensitivity as a clinician to try to help them into a better place, at least in the interaction with you. And John Gunderson used to call this the corrective experience, of having a therapist who can custom fit the relational environment to your needs, but still challenge you to think, to communicate, to be more effective, because I wasn't hedging on telling her that what she needed to work on.
Mm-hmm. The thing that that I didn't tell you that always is like the most striking event that happened to her, she was dating this guy and they got drunk and he broke up with her. And as a part of him breaking up with her or her distress, she kicked her leg through a window and ended up in a 9-hour surgery, and they had to remove her Achilles. And for me, but would that have changed how you would, if I had told you that, would that have changed how you had handled this at all?
I don't think so. You know, in my experience working with patients who have BPD, there's always something that is unexpected, but still the mechanisms are fairly the same. So I think that while I think that is a pretty important event in her psychiatric history, I think what it speaks to is how wounded she gets and how angry and expressive she gets when she loses a relationship, you know. And it's so impactful to her that she is self-destructive in these ways. And I think she has good knowledge or awareness that that kind of thing, that kind of open emotional expression is not okay for the other person and can't be repaired. Mm-hmm. And it's almost like people with BPD have this, I don't know if it's perverse to say wisdom, but she knows the relationship's ending. So it's almost like she goes full throttle and breaks everything, you know, to express the full scope of her anguish about it. And it connects to what Mary Zannarini says about borderline personality disorder. It's almost like people need so badly for others to recognize their unrelenting pain that they commit all this impulsive action that then draws other people in to be concerned about them and reinstate their feeling of being worthy of care or attention, or being in a position where others feel sorry for them or that they've been mistreated or harmed. And it becomes like a kind of vicious cycle. A lesser focus of the conversation about BPD is that I think the flagrant, angry, self-aggressive or other aggressive behaviors get everyone's attention and everybody wants to do something about it, right? And that's where I think the person with borderline personality disorder is in the best place to get better. And I always say for the people who come to our program that those who are acting out the most are sending up the most flares for help. But over time, what happens when people symptomatically remit, they just start avoiding more. And then they start doing things more quietly, but nonetheless self-destructively. That doesn't bother everyone as much and goes under the radar. And then they silently suffer. And so those people, I think, there's a point at which when there's not a true recovery, but a kind of sealed over version of BPD where the sensitivity is there, but there's covert behaviors like people pleasing or avoidance or drinking subclinically or even clinically. We didn't go there, but I suspect it's quite severe at times. That goes so much under the radar because everybody else doesn't get bothered by that as much.
What's the solution to when someone goes subclinically, their avoidance behaviors become less obvious clinically?
You have to, on the one hand, ask the person, are you okay with this? Because if they're not, that will drive them to do something about it. And I think she still has a part of her that wants to continue to improve her situation. And that's also where the relationships around matter, whether her friends or significant others in romantic relationships start to get concerned about her and push her into getting help. That can also be a factor that motivates change. But those who are very isolated, very little motivates change for that kind of scenario. And that's where I think those individuals with BPD who have kind of quieted down their symptoms, take matters into their own hands and suffer subclinically in an isolated place, I think they have the most difficult prognosis emotionally.
Interesting.
I was curious if you have observations about how her BPD adds in a optimistic way perhaps to her personhood in addition to the difficulties that it causes her. I don't know if you have any observations.
That's actually reminds me of a thought I just had a few minutes ago, is that there are several people who have written about the evolutionary benefit to having BPD. And there is this sense that there's something incredibly adaptive about it, that people who need others have this way of signaling so obviously that they're vulnerable and they want someone to be there for them. And I do think there is this way in which she does that is and has been important to her emotional survival. So the question is, can she replace some of those activities that send those signals to others to a form that is more effective at doing that sustainably? That's what John would have said about it, is how can we help you do that in a way that's not as unpredictable and disruptive to you? Because if you can do that, your symptoms will go away.
Any other words of wisdom to any?
I can see why you selected Charlotte for this interview, because she's actually she's a good face of BPD. She obviously has BPD, but you see the kind of appeal and the potential in her, but also the destructive potential. So that's what's difficult about the situation. It can go both uphill and downhill, and often does kind of some cycle of both.